Today marks a decisive change in federal nutrition policy, made possible by President Trump's leadership and the work of MAHA moms and public health advocates who demanded reform. Today, in accordance with President Trump's directive, Brooke and I will release the dietary guidelines for Americans 2025 to 2030, the most significant reset of federal nutrition policy in history. These guidelines replace corporate-driven assumptions with common-sense goals and gold standard scientific integrity. These new guidelines will revolutionize our nation's food culture and make America healthy again. For decades, Americans have grown sicker while healthcare costs have soared. The reason is clear. The hard truth is that our government has been lying to us to protect corporate profit-taking, telling us that these food-like substances were beneficial to public health. Federal policy promoted and subsidized highly processed foods and refined carbohydrates and turned a blind eye to the disastrous consequences. Today, the lies stop. The new guidelines recognize that whole, nutrient-dense food is the most effective path to better health and lower healthcare costs. Protein and healthy fats are essential and were wrongly discouraged in prior dietary guidelines. We are ending the war on saturated fats. Diets rich in vegetables and fruits reduce disease risk more effectively than many drugs. Whole grains outperform refined carbohydrates. Added sugars, especially sugar-sweetened beverages, drive metabolic disease, and today our government declares war on added sugar. Highly processed foods loaded with additives, added sugar, and excess salt damage health and should be avoided. As Secretary of Health and Human Services, my message is clear: eat real food. Nothing matters more for healthcare outcomes, economic productivity, military readiness, and fiscal stability. The dietary guidelines shape dozens of federal feeding programs, including Head Start. These standards affect 45 million school lunches every day, meals for 1.3 million active duty service members, and food served to 9 million veterans in VA hospitals. Today begins the work of aligning those programs with affordable, whole, nutrient-dense food. Implementation requires coordination across the government. I'm working with many of my fellow cabinet secretaries to deliver results.